Thank you very much to Rachel and Dr. Gent. Lots of information there for us to digest, but we'll move quickly ahead. We'll move quickly ahead to our next presenter, Dr. Robert Piloto. Dr. Piloto is the medical director at Huizenga Executive Health Department at Cleveland Clinic, Florida. He has been a board certified in internal medicine since 2003 and is a fellow in the American College of Physicians since 2017. His main interests are in general prevention of conditions such as cardiovascular disease, cancer, hypertension, diabetes, and obesity. He will be presenting tonight on the prevention of disease with proactive care, and we are thrilled he has taken time to join us in the Cayman Islands to share information and knowledge on prevention. Ladies and gentlemen, join me in welcoming Dr. Piloto.
Thank you very much. Appreciate that. And so I think you've seen some numbers already as we're going to start this talk. And unfortunately, we see that obesity, diabetes, and so many other diseases are taking a hold of our societies. And I agree, sometimes it's not about how long we live, but it's the quality of life that we have. And these diseases continue to make that quality of life decreased. So the talk that I'm going to give to you today is, the hopes is that we can catch these cases early or catch them before they even begin, because once they're there, they're very difficult to manage. And not only here in the Cayman Islands, but everywhere in the world, especially in the United States. You know, when I see that list of the top 10 healthiest countries, and I think of the United States with all the resources that we have and everything that's available, that unfortunately we can't get there. And so I'm going to show you some numbers, and I'm going to talk to you about multiple diseases, including diabetes and obesity, to show you that we definitely can make a difference, but it's going to take everybody. It takes a village. So I wanted to thank the Cayman Island Ministry of Health and Wellness for having me, and I want to thank all of you for being here. This looks like an amazing conference, and so I'm privileged to be part of it, so thank you. So when we talk about preventive medicine, I think we always have to have sort of a definition to the things that we talk about, right? So preventive medicine is the practice of promoting preventive health care to improve the patient's well-being and prevent disease, right? And that's the key word, prevent disease. We know we're not always going to get there, and disease may come, but the goal is to try to prevent it before it does. And the goal is ultimately, as I say, prevent the 3 Ds: disease, disability, and death. And if we can remember that as healthcare workers, we can definitely make a difference because it starts early. And I think something was mentioned by passing the baton, right? Sometimes as we're children, we go see our pediatrician, and between our pediatrician and then we get into our 20s and we feel great, and we don't see a doctor again until we're 40 or 45, right? If we're lucky. Sometimes it goes even beyond that. And that's the problem, that within that time span, a lot of things can happen, and that's when disease starts to take a toll on the body. So being proactive and not reactive in healthcare is really important. When we see numbers of diabetes, amputations, what we're doing is we're being reactive. Why not try to take that approach and be proactive, right? And that's, hopefully, if you take anything out of today's talk, is that. Where can we be proactive? Okay. So I think it's important to define the stages of prevention. So this is the area where we want to have our patients, is we want to see them when it's primary prevention. Why? Because this consists of the healthy patient, right? The patient that has no disease. This is where we want to catch these patients. so that they can come in, get their physical, get their blood work, check their blood pressure, make sure things are going well. And if we do start to see any changes, well, then now we can intervene and intervene properly. And so immunizations, pre-exposure immunity, tobacco cessation programs, all forms of primary prevention. Now, when we talk about secondary prevention, this is what we typically see, right, in our practices, is we're going to see a person who has subclinical disease or is starting to have some disease that we find, whether it's blood pressure or maybe there's some abnormal cells or a polyp in a colonoscopy. And so now we can intervene early in these patients and be able to treat that condition before illness can come on. So secondary prevention, some of the things that we can do here is mammographies, colonoscopies, pap smears. These will all be examples of secondary prevention. And so for us as clinicians, physicians, the most important thing is if we can catch patients in this first stage and secondary stage of prevention, that's where we want to be. But unfortunately, right, we can't bring patients into the clinic and force them in there. Sometimes they have to come on their own. And sometimes when they do come on their own, they may not have the resources to get some of these preventive tests done. And sometimes even in government, it's very difficult because some of these things can be expensive and not feasible for our patients. And then we talk about tertiary prevention. So unfortunately, a lot of the patients that we see in our clinics, this is what we try to do, right? They're already sick, they're coming in, and now our goal is to try to make sure that these conditions don't progress over time. And if they come in and they do get their checkups and we do catch this, we can help them try to live a quality type of life if we catch them early enough. But unfortunately, most of the time patients go to see a doctor, it's usually in an emergency room setting when things are too late. So that's the difficult part, is that that's when most people get their health care, not in a primary care preventative setting. So are preventative services worth the cost? So a lot of these tests are expensive. And so we say, you know, to get a physician to do a colonoscopy, or someone to come in to get their mammogram, or someone to come in and get blood work. These things are costly, but are they worth it? And the answer is yes, absolutely it is. A lot of the governments in the US with insurance will cover a lot of these preventive exams and tests, but unfortunately, people who don't have insurance are the ones that sometimes need it the most and are not able to get these because of the cost of these procedures. But is it worth it? Absolutely it is. Because then you see the other side of it, right? If you don't pay up front and you don't try to manage these conditions, then you will pay the cost on the back end of it, which is hospitalizations, amputations, heart disease, lost wages, and quality of life. So ultimately, we're going to pay the price for this. And so it's really critical to take that toll and say, hey, you know what? This has got to be done, and pay the cost up front. So why are some of these preventive services underutilized? Unfortunately, in some places they are available, and yet people don't utilize them, right? And we don't know exactly what prompts somebody to come in and see a doctor or get checked out, but we do know that there are a few things that do impact people. And so I don't have riddles, but I just wanted to kind of throw this word out there to see if anybody's ever heard it. So has anybody heard of latrophobia? Okay. So that is the fear of a physician, the fear of doctors. And so unfortunately, there's a lot of people out there that are afraid of physicians. And I always say, we don't bite. Although some people can be a little bit, difficult, but most physicians are here to do the right thing, and so please don't be afraid of us. We're here to help, and we're here to try to make things better. But it can be scary, right, to go to a doctor. No one wants to hear that they have high blood pressure or diabetes or any of these things. So what do? we just continue through life and hope that nothing ever happens. And we know that that's not the right approach. We have to go in and find out what's going on so that we can manage these conditions. And then I hear this all the time, right? I'm healthy as a horse. I don't know how healthy a horse is, but I've seen some sick horses, and unfortunately, people feel this way. They feel well, and then they don't go see the doctor, right? We should be seeing a physician when we feel at our best. That's when we should be seeing them so they can manage us, not when we're not feeling well. And so, unfortunately, cost of measures, of procedures are another issue. Lack of time from physicians. In the U.S., to get an appointment with a physician takes so long, sometimes 3 to 4 months, and so difficult. And then we look at the other side of patients who are busy and working and don't have time. And a lot of the times, us as physicians sometimes are the worst patients because we don't have time for ourselves. We take care of our patients, but we don't take care of ourselves. And so if you look, it takes all of us to look into ourselves and say, hey, I feel good, but I'm still going to make that appointment and I'm going to go and get my checkup. So how can we improve preventive medicine? How can we get people to buy in, right? Sometimes it's very difficult to do that. But one of the things, and I heard it earlier, patient experience or patients trusting us or feeling comfortable with us. And I think that's really critical. When patients are asked, why don't they go see a physician? A lot of them is they're not comfortable, they're scared, they don't know what to expect, they're fearful. And so they just don't go because they don't want to know. So if we can facilitate that and really make them feel comfortable when they come in the first time, not make them feel judged or uncomfortable, it takes that human touch, right? It really does. When you see someone that may be overweight or someone that might have elevated blood pressure or someone that just doesn't know what a colonoscopy is, right? To be able to educate them and make them feel comfortable and say, hey, it's okay you don't know that. It's okay that you're a bit overweight, but what can we do to improve things? And that's the human touch that we need to make people feel comfortable. And from my experience, what I see is that when you do make people feel comfortable, they come back. Not only do they come back, but they bring their family members back. And for a physician, I don't think that there's a better honor or privilege to take care of other people, other family members of our patients, because that tells us we're doing a great job. And so that's what we want to try to do, because that one person can bring in 2 or 3, and all of a sudden, now you're taking care of more people and finding if there is any abnormalities there. So can we improve the appointments, visit-related processes? I think we can, but that's a challenge, right? We don't have enough physicians. We don't have enough healthcare workers out there sometimes. And when we do, there's a word that's out there that's called burnout, right? Because the doctors are overworked, and sometimes they don't follow up. They don't update themselves. And so the visits are quick, and a lot of these preventative things are not talked about. And that's the difficult part. It's from both sides. And so we have to have a positive patient-physician relationship. We have to have enhancing communication, not only with our patients, but our communities as well. At the Cleveland Clinic, one of the things that we do is we try to get out to the community, whether it's what we call the YMCA or the drugstores, and talk to patients about high blood pressure, diabetes, to educate them, to have them come in and get checked out. And sometimes we even have mobile services where we go around doing mammograms and even checking blood sugars, EKGs, blood pressure, to try to get out into the community and find these things earlier, because we know, unfortunately, sometimes those patients aren't going to come to us. Now, is there harm in prevention? Because a lot of people, right, think that, well, if I'm going to do these tests, are they going to cause me harm? And unfortunately, the answer is yes, right? There's always harm in prevention, although if we look at the risk-benefit, health benefit, right, the risk is minimal to what we're going to improve in that patient's health and life and quality. But you always hear it from patients. It's the one neighbor or the one family member that had that perforation in a colonoscopy, or the mammogram was a little too hard on the breast and it was just really uncomfortable, or these type of things. And so once they hear that, they have a reason not to go get these things done. And so that's where we come in. We have to educate our patients and let them know that, yes, there is a risk to some of these things. We don't have to go too far with immunizations, right? When COVID hit and these new immunizations were coming out, in order for patients to feel comfortable, they had to talk to someone. They had to be educated, because everyone is under the impression that, oh my God, these vaccines are going to cause all kinds of issues. And for the first time in my career, I had patients tell me, I don't feel comfortable with what you're telling me. Your information is coming from the CDC. I have all these other websites that are telling us these vaccines are dangerous, that people are going to track us, that it's going to cause infertility. And so when these things get out into the media, people buy them, they listen to these things. And the unfortunate part is that they don't have someone in their lives, a physician, or someone that they can come talk to. And so for me, my family comes and talks to me about vaccines, about colonoscopies, and they always want to have someone to talk to. But if you don't have a physician in your life or in your family, then what you do is you read the media. And when you read the media, there's a lot of misinformation out there. And that's what ends up happening, right? And that's why people sometimes are fearful of physicians. And that's what we're hoping to change. And until we don't change that, we're not going to have people come to see us and get these preventative measures. But it's not all on the patient, right? We also have to educate our physicians, our staff physicians. At Cleveland Clinic, we have physicians and we train them, our fellows, our residents, to make sure that they understand the importance of preventive medicine. So if the physicians aren't educated properly, then sometimes things can fall through the cracks. So it's important to get buy-in from our patients, but they're only going to get that in one way. Either they come to see us, and when they do, that we treat them with respect, empathy, and talk to them in a way that they can understand it, because unfortunately, sometimes the medical lingo can be pretty confusing, and we have to make sure that we talk to patients in a regular language, right? To make sure that they understand the importance of these things. So in the United States, we have governing bodies that look at these preventive tests and tell us, hey, these are okay. The risk to benefit ratio of these tests are okay. So we have the United States Preventative Task Force that helps us, especially with primary, secondary prevention. We have the Advisory Committee of Immunization Practices through the CDC about recommendations for vaccinations. Although I've been told, people tell me, the CDC is lying to you, right? They're lying to you. They're not giving you the right information. And I always say, well, where should I be getting my information from, right? And so I trust in the CDC, and I do trust in what their recommendations are. And that's what we always stand by. But you will hear that. And please, if someone tells you that, don't be afraid of vaccinations. Don't be afraid of these preventative tests. They can save your life and maybe even a family member as well. We have the Women's Preventative Services, which makes recommendations for women. And we also have the American Cancer Society. And so one of the things that has changed in the last few years was that colonoscopies, typically we started at age 50. But what we started to notice was the cases of colon cancer weren't going up so much in 50-year-olds, but we're starting to see more cases in younger patients under the age of 50. So the guidelines changed from 50 to 45. And so now everyone had this number 50 to get a colonoscopy. And now we know that we got to do it at an earlier age, at 45. And the earlier we do these things, the better the prevention. So what are some preventive screenings that we should all be going through? So for me, the most important one, the simplest one, blood pressure monitoring. In my opinion, everyone should have a blood pressure machine at home. Just like our cars that have a gas gauge, oil pressure gauge, all these things, we should know what our blood pressure is. We should know what our weight is. But it's not just about knowing what it is, right? We have to have markers and definitions, because we didn't know what a high blood pressure is. We need to know what a BMI is. So we have to educate ourselves on these things. And as physicians, we have to educate our patients and our communities on what these numbers are. Unfortunately, some people may have a blood pressure of greater than 140/90 and feel like maybe that's normal. But if they know the definitions to a lot of these conditions, now they have that power to make a difference. So when we look at our gauge and we see it's getting close to E, right, empty, we know we got to go get gas. If we see our blood pressure is going 140/90, well, we got to come in and get that checkup and see what's going on and make sure that it gets managed and managed properly. We already spoke about diabetes, right? Diabetes screening. Sometimes diabetes screening is so simple. A simple fasting blood sugar can tell you whether you have diabetes or not. And now we have other tests. We have hemoglobin A1Cs. And so there's a lot of different things that we can be doing. But if we want to have and prevent disease, these are the screenings that we have to have in our practices. We have to be able to check cholesterol. We have to make sure that our patients are getting their mammograms, colonoscopies, pap smears. We want to make sure that we talk to them about diet, exercise. We want to make sure that if they smoke, that we educate them why they should stop. And if we can do that early enough, we know that we can lower the risk of lung cancer. So, cardiovascular disease. So I think we talked, and you saw some of the statistics on diabetes and some of the things diabetes can do. But diabetes is not the worst killer of all. The worst killer of all is cardiovascular disease. And this is where we need to be focusing on. Diabetes, hypertension, all these things can lead to heart disease, so we need to be aware of these things. But cardiovascular disease remains the #1 killer in the world, more than cancer. A lot of people feel that cancer is probably the biggest killer, but no. And so if we look at some of the data that we have here, right? Not only is it the world's biggest killer, but it's responsible for 16% of the world's death and about 17.9 million per year. And in the US, almost 700,000 people have died of heart disease in 2022, and the 2023 numbers don't look any better. And this is unfortunate, right? Cardiovascular disease is the leading cause of death, not just for men. Everybody thinks it's men, but for women as well. So ladies, sometimes we have that false sense of, hey, I'm okay. Women don't get heart attacks. It's mostly men. But what happens there is that most women end up getting heart attacks at an older age. So for men, it happens between the mid-40s and 50s. For women, it tends to happen a little bit later on in life, 55, 60, after menopause. So be wary, be aware of heart disease. And so one person dies every 33 seconds in the US from heart disease or some kind of cardiovascular complication. So when you hear that, that's pretty scary. And not only that, right? We talk about quality of life, quantity of life, but we also have to look at the economic toll that this has on our societies, on our governments, right? So we start talking about the cost of healthcare for cardiovascular disease is about $240 billion per year and causing about $147 billion in lost productivity on jobs. So when we start seeing these numbers, we know we have to start making a difference. Okay. So the risk factors for cardiovascular disease, I think, are pretty simple if we kind of look at what leads to heart disease. And so high blood pressure is, to me, the most important one and the simplest one to really manage if patients come in. We call high blood pressure the silent killer. And by definition, it's a blood pressure of greater than 140/90. But we're now looking at even lower numbers, and we call that pre-hypertension, when blood pressure starts getting into the 130s/85. Why? Because we want to know that if patients are starting to get there, can we manage them earlier? High blood cholesterol. Anything over 240 on a cholesterol screen, also another cause for heart disease. And then smoking. So unfortunately, about half of Americans have one of these three risk factors. And so how important is it to be able to educate them and let them know that these risk factors can catch up to them? And unfortunately, some of them have 2 and 3 of these at the same time, right? And that's when we know they're probably going to be in trouble as they get older. Now, several other medical conditions and lifestyle choices also affect heart disease. Diabetes, obesity, which I think we already spoke about, unfortunately, and it is an epidemic. And so it's there, and it's growing, and it's not in the US only, it's all over the world. And so it is important to start to manage that. And how do we do it? It can't just be one way. Patients can come in and get checked for their weight, their BMI, and see where they are, where they should be, but it takes more than that. A nutritionist, it takes an exercise physiologist to talk to them about activity and how much activity they should be getting. So it's multiple things to manage obesity, but we know that it can lead to heart disease as well. Unhealthy diets. I think we mentioned when our kids are saying, hey, what's for dinner? And we're saying McDonald's and Kentucky Fried Chicken, and this is the best foods that we're giving our kids. It's not good, right? It's not good when our children are saying that. And I'll show you a few numbers on statistics on kids with obesity, as that epidemic is growing there as well. And so the best way to avoid all of this is early detection, right? Early detection of high cholesterol, high blood pressure, sugar, diabetes, obesity. So again, it comes down to catching these things early. So cancer. I think we're going to probably have a couple of talks on cancer, especially pancreatic cancer. I think that's one of those cancers that really, has killed a lot of people, and it comes on, and before we know it, it's there. But it's not the most common cancer, right? The most common cancer is breast cancer. And that's why we tell all of our patients, you need a mammogram. And that's why it's so critical to get a lot of these screening processes. Because when we look at the top 4 cancers in the world, breast number 1, lung cancer number 2, then we have colon cancer, and then as a 4th, we have prostate cancer. And these make up about 30–40% of the cancers out there. And all of these could be preventable if we talk to our patients and get them in soon enough, or you guys encourage them to come in and see if we can prevent this. But almost 10 million people die from cancer each year around the world. In the US, about 1.7 million people are diagnosed with cancer, and almost 600,000 die from it yearly, making it the second leading cause. And the cost that incurs on our governments is over $240 million by the year 2030. By the year 2030, that's how much of an impact it's going to have on our government. And the best way, again, early detection. Sometimes once cancer's in the body, it's sometimes very difficult to manage it, even though we'll probably hear throughout this conference all the things that can be done for cancer now, which is just unbelievable. So diabetes, right? So I think when we talk about diabetes, over 537 million adults from the age of 20 to 79 are living with diabetes around the world. And with a definition, so everyone is aware, hemoglobin A1C of 6.5 or above, or a fasting blood sugar of over 126. Those are the definitions that we look for, so it's important to know these. And that's why I put these on here, or put this on here, because if you go see your physician and they mention, hey, your A1C is 6.5, you know where you're at. Now, as far as the US, 37 million Americans have diabetes. Another 96 million adults in the US have a condition that's called pre-diabetes, which is really scary because pre-diabetes usually leads to diabetes, right? So if we have that number already going, we know what's going to happen with this epidemic of obesity and diabetes, right? It's going to continue to grow year over year. So we need to try and see if we could put a stop to this. And so we have complications of diabetes, including heart disease, kidney failure, blindness. And so the best way, again, if you can see the theme here, early detection. A lot of doctors now are starting to manage patients with a medication called metformin in the infancy stages of diabetes, or what we call pre-diabetes, right? Because we want to try to see if we can slow the progression into diabetes. And so we're starting to see a lot of doctors now being much more aggressive in the management of diabetes, or I should say pre-diabetes, so that they don't get to diabetes. And I think we've spoken about Ozempic already. Wegovy. These are medications that I hear about every single day. Doctor, can you please prescribe me Ozempic? I want it. I've seen my friend, they've lost 20 pounds, and I want to get on this medication right away. And so I tell them, yes, Ozempic, Wegovy, these type of medications, Mounjaro, there's a lot of them on the market right now. They are very helpful. But why are we using these medications? Why don't we manage weight from the beginning? And if there is an issue, can we manage it in other ways? But there is no question that these medications have their side effects. They can cause issues. And absolutely true, when the medicines are stopped, the weight usually comes back on pretty quickly. Because what we end up losing is a lot of muscle mass, not necessarily fat mass. So is that the answer? Yes, it could help. But to me, that's not the answer. I think we have to start with diet, activity, and just being aware. So obesity. 1.9 million adults worldwide are overweight, and 1.9 million are obese, defined by a BMI of over 30. Obesity affects 20% of children, 42% of adults, putting them at risk for chronic diseases like type 2 diabetes, heart disease, and cancer. And over 25% of young people ages 17 to 24 in the US are too heavy to join the military. And so you can imagine that, what's going to happen to them as they become more sedentary and adults. So obesity costs the US healthcare system almost $173 billion a year. So again, you see these astronomical causes. So that's why it's so important to really, really promote preventive health. Physical inactivity. As we get older, as we get busy, unfortunately, we just are not as active as we should be. And so we need to identify and define what is activity or what is too little activity. So by definition, physical activity requirements for each one of us is about 150 to 300 minutes a week. So roughly 3 to 5 hours a week of some sort of cardiovascular work. And if we start looking at our days, right, who has 10 minutes to exercise, let alone 30 minutes or an hour or 6 hours a week, right? So it gets really difficult to do that, but it's very important to do so. And so I urge all of you to get out and try to do this. Once you get going, it really is incredible how the body adapts and it becomes part of your routine. But if you're not doing it, it could bring a lot of issues down the line. And so it can lead to heart disease, again, type 2 diabetes, obesity. And so physical inactivity costs the US about $117 billion a year in related conditions and illness. So again, why are we not promoting activity, exercise, and at least an annual physical so we know where you stand? Cigarette smoking. So cigarette smoking is another one of those. And cigarette smoking is the leading cause of preventable death and disease in the United States. But obesity is right there and eventually may pass smoking as the most preventable causes of conditions and illness. So more than 60 million Americans have at least one disease caused by smoking. And so this amounts to $240 billion in healthcare spending that we could be doing with other things, right? We could be adding to other things in our government and not spending it on healthcare. And so if we could just help a young kid stop early or prevent them from smoking, or if someone is smoking, help them to quit, that's the way to go. So intervention with education of the risk of smoking is critical for our patients. And then this is one that sometimes we don't talk to our patients enough about, which is excessive alcohol use. Unfortunately, patients don't like to tell us how much they drink, right? We have a thing in medicine where we say, if a patient tells you they have 2 drinks a day, double it and maybe sometimes triple it, because that's probably the right number, right? It's not 2, it's not 1, it's probably 6 or 8. But a lot of people don't realize that they're drinking excessively, right? Hey, I'll have a couple glasses of wine, maybe 2, 3, do that every night because my doctor has told me it's good for my heart. But I'll tell you, it can be helpful if it's limited, but it has to be a very small amount, right? It can't be every single day, and it can't be large quantities. How does it help? It helps to raise our good cholesterol, and that's where it can sometimes benefit in health. But sometimes too much of a good thing is a bad thing, right? And so by definition, 1 drink per day for women, 2 drinks per day for men, that's kind of a moderate amount already, right? And it doesn't sound like a lot. Who isn't guilty here of sitting down, opening a bottle of wine and having 2, 3 glasses of wine, right? And sometimes we do that multiple times. But it is important to know what the definition of this is. So 1 drink is equivalent to 12 fluid ounces of beer, 5 fluid ounces of wine, or 1.5 fluid ounces of 80 proof distilled spirits. So my grandfather used to always tell me, hey, can you put a little whiskey in there? And he used to say, 2 fingers. And he would go like this. And I would say, that doesn't look like 2 fingers, right? But this is what happens, right? It helps to relax us, calms us down, and sometimes we use it more of a treatment for anxieties and things that are going on in our lives. So it's important to ask these questions to our patients. Why? Because it can lead to diseases in the future, right? So excessive alcohol use is responsible for about 140,000 deaths in the US each year, including 1 in 10, usually about in the working age adults, right? When they're at the prime of their life. And this usually means that there's a cost to the US economy of around $249 billion yearly, or $2 a drink. And so binge drinking is also responsible for around 40% of the deaths due to excessive alcohol use. And the definition of binge drinking, maybe we remember our college days, right? And, binge drinking with our friends. But binge drinking is 5 drinks in 1 sitting for men, or 4 drinks for women. So that doesn't sound like a lot, right? Maybe some of us are guilty here of that. Maybe, maybe not. And so prevention of diseases. How can we do this? How can we turn this around, right? How can we start to get a hold of this? Because it just feels like it's getting away from us more and more every day. So yearly physicals starting as early as possible. And I like that analogy of passing on the baton, right? Most people go to their pediatrician till they're about 18, 20 years old. But there's a big gap in there. Can we identify these patients and make sure that our pediatricians are passing on the baton to their internist, to the local doctors, and say, hey, look, I'm going to introduce you to this young person. Can you take over their care, right? That's so critical, because those 10, 15, 20 years that we lose there could be the difference and could make a difference in these healthcare costs. Eating healthy foods. Unfortunately, KFC, McDonald's, for as healthy a menu as they want to put out there, not very healthy, right? Eating at home, eating healthier foods. Getting enough exercise. I think we defined enough exercise, so 150 minutes to 300 minutes per week. So I challenge you all of you with that. No tobacco or excessive alcohol use. Maintaining healthy weight with a BMI or body mass index under 26. And so these common practices will help increase or improve health benefits, and they can maybe prevent some of the onset of chronic diseases. The good news is that we have the power to prevent it. It's just a matter of being proactive, and it takes everybody. You could be at work, tell your coworker, you could be with your family members, and if you see someone is overweight or obese, talking to them. Or if you notice that they have high blood pressure, you notice that they're complaining of shortness of breath or chest pain, hey, be proactive. Go get them that appointment. Make sure they go see someone and get their physical. So another thing that's going to be critical in this is awareness and education, right? So informing, educating decision makers in public health. So the Ministry of Health and Wellness, right? It's important that they have these conferences. It's important that we talk about this every day. It's important that we go out to the communities. It's important that we be proactive. Educating our healthcare providers. Unfortunately, some healthcare providers aren't aware of some of these preventative measures and what they can be doing, because sometimes they don't take care of themselves either. So it starts there, right? It starts with our leaders. It starts with those that can give the example. Encourage healthy behaviors, right? Provide the public and health education information. Work with the media to highlight public health issues and the importance of yearly physicals with preventative screening. And early detection and education of our patients is the key to prevention. So I leave you with that, but I am going to talk a little bit more, so I apologize. But I tell this to you because each one of you in this room has the power to make a difference. Every single one of us. We just have to do it, right? Just have to do it. And it starts with us. If you set an example at home, at work, in your workplaces, people will follow. In the executive health program that I work in, so the most successful companies usually starts from the top. They set the standard. They come in and get their checkup every year in our program, and they make every single one of their workers come in and get their physical as well. So whether, maybe raising their insurance or their premiums or whatever it is, or just being kind of stern and hard on them and saying, you're going, I don't care if you're afraid or not, you're going to go get your physical. We'll pay for it, but you're going to go get it. And I think that's really critical. So starts at the top, but it goes and trickles all the way through. And sometimes some of the best people are the ones that come and get their checkup, and they feel so good that they go and tell somebody else to do it. So see if you can do that as well, and try to just get one person you may know to come in and do their checkup and see how they feel, and hopefully they can pass it on to the next. So I'm going to talk to you a little bit about our program at the Cleveland Clinic. So our executive health program provides the opportunity for busy executives. So we have a lot of companies that work with us. And so our physical is a little bit different than what you're used to. Our physical is a one-day physical. So you're there all day. It's not 30 minutes, you come in, you do some blood work later, maybe the doctor sends you to do an EKG or, no. You're there with us all day. So it is a very efficient program. And for busy executives and busy patients, it works really well. And so we aim to be comprehensive, convenient, cutting edge, and our physicians are experienced in determination of health risk and prevention of diseases, so they're well trained. What we do there, this is our executive health assessment, and if you can believe this, we do this all in one day, okay? So we will do a comprehensive physical. We will do cardiac health screenings. We do cancer screenings, PSAs. We have our female patients go see a gynecologist, get their pap smears, mammograms. And we set up colonoscopies for the next day if they're going to be around, if not for the future. We talk about obesity. We have a fitness exercise physiologist which talks to our patients, looks at their BMI, looks at what's going on in their lives, and kind of helps them to set up an exercise program. We have a nutritionist that talks to our patients with blood work right in front of her, so she knows if their sugar is elevated. She knows if their cholesterol is elevated and can give them real-time information to be able to get the help that they need. These are our three physicians in the program, Dr. Lara Than, Dr. Matthew Goldman, and myself. And so we're the physicians that see the patients that come through the program. And our ancillary services, we have Candace O'Neill, who's our dietitian, Rachel Upton, who's our wellness coach. And with COVID, we started to notice mental health. I think mental health was already discussed, and mental health is so critical. And so we started to see a lot of patients developing anxiety, stress, depression. So we have a wellness coach that talks about work-life balances. She talks to people about depression, anxiety, suicide, these type of things. And we have Claudia Serrao, who's our exercise physiologist. We have innovative technology, so we have an in-body service or in-body machine that looks at the body mass of the patient, gets real sort of detailed weight. It will tell us what the metabolic process is or your metabolic rate, how quick it is or how slow it is. It will tell us the lean muscle mass, the visceral fat. It will also tell us the percent body fat that we each have. Because sometimes when we weigh ourselves, we don't really know. We could be obese, but it may be more muscle mass. So this is going to give us a little bit more detail on body fat percent, which I think is even more critical. We have our true blood pressure monitor. So instead of taking one blood pressure reading, this machine takes 5 blood pressure readings. We get the average, and this has been great because then we can really determine if there really is high blood pressure or not. One reading and one reading alone usually is not enough to really tell. And then we have a fundus device, which will look at the back of the eye, and we can tell a lot of diseases through the back of the eye, diabetes, hypertension, a lot of different things that can guide us there. And this is our ancillary staff, some of the equipment that we have. And so before you even come in, this is what makes us unique. We do a pre-visit workup. So you'll get a questionnaire, you'll send it in to us. We'll know a little bit about your history to begin. And then what we do is we have a nurse call you and find out if there are any other issues going on. And if there are, then we can address them on that day. So if your knee's bothering you or something else is going on, not only are we going to do these preventive measures, but we're also going to be able to fit you in if you wanted to get something else looked at, your back, your knees, shoulders. And so we do that 2 to 3 weeks before your visit to us so that we can set up an itinerary and get you very efficient through the day. So on the executive physical day, you meet with the physician, you meet with the nutritionist, you meet with the exercise physiologist, you meet with the wellness coach, and on top of that, you get your blood work done right there in our suites. You get EKG, chest x-ray, and we even do spirometry tests to see how the lung function is, especially if you've been a smoker. We can see if there's any emphysema or any obstructive pulmonary disease. So we look at your eyes, we test your hearing, and we get a full evaluation of where you are from a health perspective. And then on the post-visit, once you're done with all of this, we have a recap. So you meet with the physician again to go over all these results. And we're very fortunate that we have all these results with us right away. The blood work, EKGs read by cardiologists if we do a stress test. And we have all these results real time, so that way we can discuss and make a plan before you leave, because sometimes the difficult part is getting a hold of a patient afterwards. So this is what we do there at the Cleveland Clinic. And as I hope you get something out of today's talk, is that we have to take care of these issues before they start. If not, it can be too late, and we can see the cost that it can take on our healthcare. Thank you.
Thank you very much, Dr. Piloto. We do have an opportunity if there are any questions for